Keynote.
No.
Oh no.
Giles. Jean.
No, these ones were only. Yeah, stop the recording or mute us. Good morning, everybody, and welcome to our webinar launching the third round of the Africa Grants Programme. So you should be able to see our screen, but you're all currently on mute, so we can't hear you. The recording of the session, along with the slides, will be available after today on our website and YouTube channel, in case you have any problems with connectivity or in seeing slides. So we're hoping to have some time for questions at the end, but in the meantime, if you want to let us know about any problems that you're having with connectivity or with hearing us, then do let us know in the chat box, which you should be able to access at the top or right hand side of the screen. So my name is Beatrice Waddingham, and I'm joined by my colleague Richard Scone-Jones.
Hi everyone.
And we're here to talk you through the application process for this round of the Johnson & Johnson funding. So I'll start with just a quick run through of the agenda today. We're going to start by introducing the objectives of the AGP, the scope for it, and giving a brief introduction to the history of the Africa Grants Programme, giving you an idea of the kind of projects which we funded in the past. Then we'll discuss eligibility criteria for the round and highlight some other things that we're looking for in the applications. We'll go through the how to complete the application form, a budget, before looking at the next steps and timeline for the projects. Hopefully there's going to be plenty of time at the end for questions. So it'd be great as if you're listening as we're going through each of the sessions, you could jot down any questions that you have ready for the Q&A at the end. And then we'll ask you to answer questions either through the chat box, or if you actually want to speak, then we'll unmute you and you can just speak to the wider audience. Right, so the Africa Grants Programme is aimed at supporting the training of health workers in low and middle income countries in sub-Saharan Africa, and the funding is generously being provided by Johnson & Johnson. So the AGP is looking to engage partnerships between organisations in the UK and Ireland and their counterparts in Africa. So this includes associations of medical cadres, societies, academic bodies, NHS hospitals or NGOs working in global health. So the aim of the partnership should be to improve health services in low and middle income countries through the reciprocal exchange of skills, knowledge and experience between the partners in the UK and those overseas. As such, high quality partnerships mobilise UK and Irish health workers to develop the capacity of health workers in Africa through skills transfer, training, mentoring and other collaborative work. So the primary focus of partnerships is on capacity building and staff development through targeted training. And while they might provide additional support such as equipment and books, this isn't the primary remit of the partnerships. So the funding will support projects designed to improve the standard of clinical training at all education levels, the technical skills of staff, or the efficiency and capacity within healthcare systems. So the Africa Grants Programme was set up by Step and Johnson & Johnson in 2015, and previously J&J had already funded smaller grants to strengthen the surgical capacity in LMICs. So the first round of AGP grants ran from May 2016 to April 2017. 7 grants were awarded, and collectively they trained over 1,000 health workers and reached over 113,000 patients. So more information on the impact of this first round can be found on our website. So the second round, which began in February 2018 and will run to the end of April of this year, also funded 7 grants, and that was across four countries in sub-Saharan Africa. So projects range from the safe paediatric training in South Africa to improving primary trauma care and introducing the surgical safety checklist in Sierra Leone. So what does this round look like? So this round of the AGP is quite similar to previous rounds. Projects will last between 6 and 16 months, and they'll start from the 1st of May and end 2019, and hopefully end by the 31st of August 2020. So grant sizes are from £15,000 to £50,000, and projects must operate in LMICs in sub-Saharan Africa. So the call for applications opened on the 9th of January last week, and we'll close at midnight on the 28th of February. I know, sorry, it says the 24th of February on there, but it will be the 28th. So those wishing to apply must submit their application form along with a budget and letters of support from each of the partners involved. So as in previous rounds of the AGP, there are two streams of funding. So one is focused on essential surgery and anaesthetic care, and the other is focused on community healthcare and those reaching underserved populations such as the rural or poor. So stream one, the essential surgical and anaesthetic care, has got two objectives. Firstly, to reduce the morbidity or mortality from conditions requiring surgical intervention, and or enhancing patient safety as a result of improved anaesthetic care through the training of relevant health workers. So the second aim is to improve the access to and the availability of quality surgery and anaesthetic care. And your project might focus on one or both of these objectives, but if you're just focusing on one, we would like to see how you've considered how the other will impact on or be affected by the other. So if you do have a project which is focusing mainly on surgical care, we want to know how it will be impacted, or how it will impact on those providing anaesthetic care as well. So the objective of stream two, the community health stream, is to increase the availability and quality of essential healthcare and health information to underserved populations. So this includes women and children, by training those who work and serve in the community. So partners will primarily work at the rural and district level, generally outside of central hospital systems.
Right, on to eligibility requirements and who can apply. As with previous rounds of the AGB, we have a few eligibility requirements. So grant recipients must be eligible organisations under this programme, and please refer to the Q&A document for further information on this. Essentially, applicants must consist of a UK or Irish partner and a partner from a low and middle income country in sub-Saharan Africa. The UK or Irish lead partner must be either a registered charity that is involved in health education or health delivery activities, or a recognised UK or Irish health delivery institution, health education institution, or professional association, and this includes regulatory bodies. The sub-Saharan African partner must be a not-for-profit institution based in an eligible country that is involved in health education or health delivery, or a recognised national health delivery institution, health education institution, or professional association. Any applications made by a single organisation will not be accepted. Of course, projects must fit in with the parameters of either of the streams that Bea was talking to, and budgets cannot exceed £50,000. And we'll go into further detail during the webinar on what activities will and will not be funded. There are certain countries that we are prioritising in this programme. However, all countries in sub-Saharan Africa are eligible. Partnerships must have been working together for 6 months or more to apply for this call. If your partnership has been working together for less than this time, you'll still be eligible for the call for startup grants, which will be announced tomorrow. So do check our website for that launch. And we do ask that all applications are submitted in English. And just a list here of I think there's 13 priority countries. In the past, we haven't specified such countries, but in this stream, we would like to direct the majority of the funding to these particular countries. However, we will consider exceptional applications from any sub-Saharan low-middle country. The reason for this change is that this is from Johnson & Johnson, who are keen to expand their funding beyond the kind of usual Anglophone African countries that often receive health partnership funding. So moving on to project and partnership criteria, I won't go through every single bullet point here, but in terms of the first point, we do ask the project is single, coherent and time-bound and deliverable within the budget and timeline proposed and agreed with that. Although this project might be a continuation of one seen before, we want to see that the impact of this project can be measured within the time frame of this project. If I skip down to bullet point 5, the project is based on recognised good practice. We do suggest that you think about how your partnership links into the THET principles of partnership. There's the web link at the top of the slide here. You browse through.
Yeah.
If you're not familiar with these. Sorry, hold on one second. Sorry about that. Yeah, if you're not familiar with the THET principles of partnership and the 8 pillars that we've developed over the years working with health partnerships, 8 principles that people should consider when entering into relationships with overseas partners, and within each principle there's several hallmarks designed to help you improve your relationship with your partnership. So going back to the requirements, in terms of benefiting women, children and underserved communities, we'd like applicants to identify what barriers there are to these groups in terms of accessing health services and how the project will reach them. In addition, applicants could consider how they can encourage more women into training and support them to take on more of a leadership role within their institution. On to the next one, in terms of measurable outcomes. Once the grants have been awarded, we will have inception meetings with each partnership, part of which will focus on monitoring and evaluation. It's always a good idea to think about what outcomes you would like to see from your project and how the inputs or activities, for example, the people you train, will feed into these. You may like to use theory of change diagrams, as these are an excellent way of mapping the journey of your project. So in terms of value for money, one of the key aspects of health partnerships is to use volunteers. So more than likely it will be UK and Irish volunteers either working, staying at home and doing work from there, or travelling overseas to carry out the training. But of course, think about other ways that you can demonstrate value for money, such as online courses or communicating via Skype rather than traveling to the country too often. And then if I just skip down to the final point on sustainability, we're very keen that when planning your project from day one, you think about the implications for sustainability. If you're buying equipment, you should consider whether there's expertise and spare parts available in the country to fix it if it breaks. You should really reach out to senior management at hospitals, to regional and national governments, stakeholders, as you're designing the project, so that they will continue to support the outcomes once funding has come to an end. And yeah, for those of you who knows that, we always like a good train the trainer model, so do consider that when designing your project. So applications will be systematically assessed against these criteria, so do keep them in mind as you're filling in the application form. You're strongly advised to refer closely to the Q&A document for a more detailed explanation of each of these points. And we'd advise that you keep the list in front of you and use it as a bit of a checklist to ensure that you've covered each of the points in your application form. Some of the criteria will be explicitly linked to specific sections on the form, but for others there won't be a designated section to complete, but we will expect you to demonstrate it throughout the form or in various sections. And do remember, please don't assume that we at THET know your partnership or projects which you've delivered in the past, even if they've been funded by THET. It's not a bad idea, finally, to ask a non-medical friend to read through the application for spelling and grammar mistakes, for a sense check, and just to see how well you've responded to these requirements. And yeah, we'd advise you to fill in the application form before the budget template in order to avoid missing out any key costs.
Right, so now I'm just going to briefly run through the application form, highlighting some areas which might be of particular note to you. So I'm not going to cover every section, as quite a lot of them are self-explanatory, and some of them are covered in the Q&A document. So do always refer to that document when you're filling in your application form. So in general, throughout your application form, it's a good idea to avoid using acronyms and technical terms. Try and make your application as readable as possible, and please do respect any word limits which we provide. We've only got a limited amount of time, so if we've got some applications which are 60 pages long, we just don't have the time to go through all of them. Okay, so the first section is summary details. So as Richard just mentioned, we do advise you to fill in the project budget before you, sorry. We do advise you filling in your project budget after you've completed your narrative report, just so that you don't end up missing out on key activities and things. And do be aware of the minimum maximum amount. So the maximum amount we'll fund is £50,000, and though you're perfectly welcome to apply for this amount, just bear in mind that that might alter the amount depending on the number and size of successful applicants that we have. So duration and start date. Projects must be completed by the 1st of August 2020, with the required duration being a minimum of 6 months and a maximum of 16. So projects can start from the 1st of May, but they can also start later depending on your timeline and the duration of your project. Okay, so section 2 is the partnership section. So please do include all the details of all of the main partners here. You can add more boxes as necessary. We do include a space for managing partners or additional partners as well. So do ensure that you put them in. And then any other partners who might not be included in the main, the actual delivery of your project but might contribute to other areas of it, do list in section 2.3 the other project partners or stakeholders. This might include things like the Ministry of Health or other organisations working on the ground that you'll engage with. Okay, so section 2.5, so this is your chance to tell us about your partnership. You should always assume that we don't know about your partnership, even if you have received funding from us in the past. So we want to know what the history of the partnership, how you originally set up, how you established the need for the partnership, and what you've achieved. So as much specific detail as you can put here will help, especially if you can give evidence of how successful previous projects that you've run have been. So if you're able to give the number of people trained, how you've increased their skills, or some evidence of behaviour change, that will help us to convince us that you're able to deliver and measure high quality projects. So yeah, this is the section where you really need to sell your partnership to us. Right, so section 3 is the justification for your project. So 3.1, we want to know about the approach that you've used for your needs assessment. So we'll be looking to assess whether your research and methodology is appropriate and relevant to the context in order to come up with a clear and well-evidenced need. Section 3.2, so we want you to describe the findings from your needs assessment. What's the issue that you're seeking to address? Do ensure that you try and address all 3 of those points, which are part of the assessment criteria. Think about the operational environment. So it could be to do with the actual institution that you're planning on delivering your project in, or it might be broader, so it might include the national operating environment as well. And then section 3.3, so here we're looking for information that the project that you're proposing suits the local context, and that you've really looked at other organisations or partners who are working on the same issue, just to ensure that you're not duplicating work and that your project doesn't contradict or significantly overlap with others. Okay, so section 4 is about the project itself. So in section 4.1, so those of you who've completed applications for SEP before will see that we're no longer asking you to complete a project plan with indicators and targets and things at this stage. That's something which will happen probably during the inception meetings once the grants have actually been awarded. But we are, however, asking you to describe the changes that you expect to see as a result of your project and in relation to your overall goal. So it's a good idea if you can try and tie these in with the overall goal of the Africa Grants Programme itself, relating to the stream which your project relates to. And you'll find some good examples of these changes in the Q&A document. So as I mentioned, do expect to complete a more detailed project plan if later on if you are awarded a grant. And then, okay, so changes by the middle of the project are the changes that you'd expect to see soon after the intervention or activity. So in other words, those of you who are more M&E minded would know them as the outputs. And then changes by the end should relate to the changes that come later on. So these should be linked to your middle changes and reflect the next stage. So again, it might be useful to map your changes in a theory of change just so that you can see the path that your project will take. So do avoid including more than 4 changes in this section, as any more than that will be too complicated for what is essentially a relatively short project. Okay, section 4.2. So again, we haven't asked you for a full MEL project plan, but in this section we'd like you to describe the kind of MEL systems that you have in place, the type of data that you'll be attempting to gather, and how you'll go about doing this. Think about who will be involved in the processes, what kind of systems you'll use, and how any data that you do collect will inform learning throughout your project.
And just to come in, generally it's great if both the UK and Irish partner and the overseas partner are jointly involved in those processes.
So section 4.3, please list all of the activities which you're planning on doing as part of your project. The more specific you are, the more of an idea that we'll be able to gain about what your project entails. So do add more lines if necessary. And be aware that we might come back to you with questions about specific activities before we decide whether or not to award the funding. Okay, so section 4.5, so this section is designed to give us an idea about the scale of your project and the general figures of people that you're hoping to reach. We know that at this early stage this will only be an estimate, and that's fine, but we would appreciate it if you could try and be as accurate and give as much information as possible. So if you are awarded a grant, we're going to aim to try and specify or firm up these figures in your project plan, and then looking at breaking them down by cadre and gender. Again, if you do have the figures available and you can break them down by cadre and gender, that would be very useful for us. Okay, and then section 4.9. So as mentioned above, we're particularly keen to fund projects where the partners have thought about sustainability into the future once the project funding cycle has come to an end. Sorry, this is section 4.10. So do use this section to explain how you've thought about this and what your plans are for ensuring sustainable outcomes. So Richard mentioned earlier that things like training the trainer models or some kind of distance mentoring system. These are ways that we can help you, how we can see that you're maintaining sustainability, you've thought about sustainability in your project. Okay, so section 5, when completing this section you should pay close attention to the partnership and project criteria that Richard discussed earlier. So section 5.1, the information that you provide here will help us to assess your partnership's capacity to deliver the project. So please note that if your project is shortlisted, we might ask you to provide documents to support this. So for example, memorandum of understanding that you might have between partners, or specific policies that you might have in relation to decision making or governance. Okay, section 5.2. So when you're filling out this section, I'd advise you to refer to the principles of partnership on our website that Richard mentioned earlier. So this section is designed for partners to outline how there is an institution rather than an individual will benefit from the project. So we expect partnerships in their project to be mutually beneficial and to promote learning and respect, among others. And we expect each partner will work together according to their expertise and the capacity that they as institutions have to deliver the project to the best of their abilities. Okay, finally, section 5.3 and then a bit further down 5.5. So when discussing volunteers, please do make it clear whether you're sending short-term, long-term or a mixture of volunteers. So it's important to remind ourselves of the purpose of the AGP and the mutual benefits for both the UK health system and the LMIC. So we would like information on how it will benefit the UK volunteers and the UK health system at a wider level by volunteering on the project. So volunteer management requires having important systems in place, such as the duty of care, volunteer recruitment and management policies and procedures. So do see the Q&A for more details on this. Okay, thank you. Over to you, Richard.
Thanks, Bea. So, on to the budget template. This won't differ significantly from previous years. We've updated it very slightly so that applicants and reviewers have better visibility of budget allocations per category, whether budget limitations are respected, and where each of the costs sits within the activity plan. Some of the cells within the spreadsheet are locked, such as the summary section at the bottom and the total costs columns. These cells contain formulas which will automatically populate the cells as the budget template is being completed. When completing your application, we do recommend that you complete the narrative part first before attempting the budget, and once you've established your changes and activities you'll be undertaking to achieve the changes, you can then begin to consider the related costs. So moving on to categories section. So what do we have here? So the rest of your categories are standard travel, equipment and project management costs, which you'll be familiar with if you've applied for funding from TED in the past. I'll hold a photo of that in this page. You'll need to populate the cost per unit and the number of units and provide any relevant details in the notes section on the far right. As with previous funding calls, project management and equipment and refurbishment costs should not exceed 20% of the overall budget each. We would expect monitoring and evaluations to make up 5 to 20% of your overall budget, and this can include research and dissemination. And now if I go here, this is at the bottom of the budget form, and it's a summary of each category line to ensure that you won't exceed limits for any of the categories.
Okay, so finally, just an overview of the application process and the timeline that we're hoping to work to. So, as you know, the call for applications opened on the 9th of January. If you do wish to apply, partners will need to submit a completed application form and budget to agp@thet.org by midnight on the 28th of February. So once you've submitted your also, along with the application form and budget, you also need to submit letters of support from each of the partners involved. And then once you've submitted your application, you should receive a confirmation of receipt within 48 hours. And if you haven't received this, then please do resubmit your application with proof of the original submission if the deadline's already passed. But do be aware that obviously if you submit your application at 8 o'clock on a Friday evening, we're probably not going to respond to it until Monday. So then Staff at THET will do a preliminary shortlisting of the applications based on eligibility and against the project and partnership criteria. If you're shortlisted, both partners will then be invited to attend the meeting with THET so that we can better determine the strength of your partnership and project. So though you're not going to be rejected if you can't attend this meeting, we'd highly recommend that you do make space in your diary for it, as those that we meet will be a significant advantage because we will have had a chance to explore the partnership further. So once these meetings have been completed, the External Selection Committee, which is going to consist of professionals working in the 2 stream fields along with their staff, will meet to decide on the final outcomes of the call. So applicants hopefully should be notified of the outcomes by the 1st of April. And in some instances, funding might be awarded conditionally dependent on the outcome of inception meetings and then clarifications. So throughout April, that will then carry out inception meetings with successful applicants in order to develop and finalise M&E strategies and project plans, with the view that projects will start on the 1st of May 2019. Great, so I would now like to open up the floor to questions from our audience. Perhaps if people have got questions, you can either type them into the question box and then we can read them out and respond to them. But alternatively, if you'd like to speak yourself and let us know, we can invite you to unmute yourself and ask your question. Oh, Dennis, are you putting your hand up?
Yes. Can you hear me?
Yes.
Yeah. I just wanted to find out how many applications you're planning to. How many grants you're planning to give out, and what's the total amount of what's the total fund available?
Yeah. Thanks, Dennis. The total fund is just over £310,000.
Okay.
So that is for both the established partnerships that we've spoken about on this call, and also for startup partnerships that is being launched tomorrow. So it depends how many of each we select, but we're probably looking at between 7 and 10 successful applicants.
Okay, thank you very much.
So Beth has asked about the beneficiary audiences, and does the full audience need to focus on women and children, or will part of the audience focus on women be sufficient? I think from our point of view, I think the sole focus does not need to be on women and children. I think a acknowledgement of the barriers to those groups would be very helpful and be advantageous to the application and then the actual project. If it makes sure that you are following through on trying to mitigate those barriers, then again that would be advantageous. But it's certainly not only, this grant scheme isn't only focused on women and children.
Fab, thank you. This is Beth. Thanks very much.
No worries.
I've actually got another question about the duration of the projects, if that's all right. So you mentioned that they need to last from between 6 and 16 months. Mm-hmm. So I'm working with the Surgical Foundation, we use a train the trainer model, and so it's kind of short bursts of activity. So when you say it needs to last from 6 months, could that include the training and the monitoring and evaluation that goes on after that train the trainer model? Do you see what I mean?
Yes, that would be fine with us, because monitoring the activities would, in our view, count within the project itself. So yeah, that's fine with us.
Brilliant. Thanks very much.
Thanks, Beth. And we have a question from Daniel, who's asking whether we can throw more light on overseas country policies and plans. So, this is really for applicants to, as part of their initial scoping or needs assessment, to look into this. We'd advise that you speak to national stakeholders who are involved in the stream, so whether it's approaching a technical working group within the country that focuses on surgery or community health, or other members of the Ministry of Health, and just finding out their particular priorities in the next couple of years. Also looking at their health strategy over the course of this stream, and any national action plans they have be very helpful. But yeah, we're looking for applicants to reach out to those stakeholders to get any additional information. Okay, so we have a question from Stan Daniels.
So we have a training program in skin cancer prevention for people with albinism, which incorporates both skin surgery, dermatological examinations, and health education, therefore bridging both grant funding streams. Could our project seek funding for both, or do we need to select one of the two streams?
But I think the thing is, there's no one pot that we have. Kind of half the money is available for surgery and half is available for community health. So I think, so maybe we can get back to you on this one. At the moment, my inclination is that you could just tick both boxes, and then we would, judge it on those merits. But maybe let's have a think about that and get back to you.
Yes, I mean there are slightly different objectives within the two streams, so it might be worth looking to see which one of those your project speaks best to. But yeah, let's have a think about that and then get back to you.
Yeah. Okay. So another question is, how should the projects align with this? Do countries in other sub-Saharan African countries have equal chances with countries mentioned? So, I mean, the short answer is no. We are prioritizing the countries that we listed. However, because these countries historically have not had many health partnerships at all, we're not necessarily expecting too many applications from these countries. So where there are exceptional applications that fit very well into the two streams, they will be selected.
I mean, primarily we're looking for quality more than anything. So quality projects are going to be the ones that are awarded the funding over place, really.
Hi there, it's Beth again. Could I ask another question?
Yes,
Yeah.
please.
Hi. So do you have a sense of the sort of proportion of the overall budget of a project that you would like to fund? For example, hypothetically speaking, if a project was costed at 50k, do you make a significant contribution towards that? And I know, for example, some funders like to be the main funder, some funders like to make a contribution, and I know that you have a number of projects, but do you have a sense of the proportion of a project that you would like to fund?
I'm not quite sure of the question. So we would fund anything up to £50,000, and that would be for a project in its entirety. Are you suggesting that you have funding, or you could get funding from another partner, another donor, and that this 50k would be part of a much bigger project?
No, I'm not suggesting that. I'm suggesting that if our budget came to 50k, would you aim to fund the 50k, or would you say, we'll give you 30 towards it because we want to give 20 to another project?
Oh, I got you. So yeah, match funding. No, we would fund the entire project. So what I think he was mentioning, we may try and just negotiate a few costs with partners. So whether if some applications we think could reduce their costs on a few budget lines, but it wouldn't be anything more than kind of 5% of the budget total, and it would lead to a potential reduction in the targets that they set out, or the number of activities that they could do. No, we're not looking for additional donors to come in to fund the new amount. If your project, I mean, I'm answering my first point. If what you're proposing is a smaller project within a larger project, and applicants do have funding from other donors, that's absolutely fine as well, as long as the specific project that you're applying for within this stream has measurable outcomes that aren't contingent on other funding project activities.
Perfect, thank you. There's one other thing I wanted to ask is around the theory of change. So you mentioned using the theory of change diagram can be quite helpful. Is that is that something that you expect to see? Would you like it attached as well? Or would you just like to know that we've done it, but not to bombard you with more attachments?
Yeah, no, it's not a requirement at all for you to send it to us or anything. It's more just a kind of guidance method for yourselves in terms of formulating your activities and changes. Obviously, if you do want to send it to us, that's also fine. But as I mentioned, because we're going to have limited time to look over the applications, it might be that we don't get round to looking at it. I mean, you could mention that you've formulated one, and that would speak in your favour in terms of clarity of the project, but it's not a requirement, no.
Perfect, thank you.
Thanks, Phil. Pamela's asked, we need more clarification on the
Foreign partners.
Foreign partners, of course. Let me come on to that. Should we go, do you want to take the next question?
Yeah, okay. For new so Fiery is asking, for new projects that have not been funded before by THEP, would you suggest that they first apply for new startup grants, which you said that you would announce tomorrow? Okay, so the startup grants are for partnerships who have been working together for less than 6 months. It's kind of irrelevant whether or not THEP have funded them in the past. If you've been working together for more than 6 months and you feel like you have a strong partnership and the project that you're delivering is strong, then feel free to apply for the regular grants. The startup grants are for the startup of new partnerships who haven't worked together before.
Yeah, thank you, Lee. And so just on the overseas partner, so it should be a not-for-profit institution based in a lower middle income country in sub-Saharan Africa. And this institution must be involved in health education or health delivery. Or it can be a recognized national health delivery institution, a health education institution, or a professional association. I think if further clarification is required, Pamela, if you can email agp@thep.org and just with maybe with the name of the institution that you're thinking of working with, and then we can just let you know whether it's eligible or not. It's probably the easiest way. And sorry, yes, we should have mentioned we will be putting these slides on our YouTube channel.
Yeah, and on our website. So I think probably that won't be until early next week, as our communications manager is out of the office at the moment. But yes, in the next few days it will be on our website.
We'll just leave it a minute just in case any more questions come through. But at the moment, I think we've covered all of them. Yeah, so Daniel's asked whether the startup grant will benefit from the same funds. Yeah, so it's all part of the same program funded by Johnson & Johnson. Total funds available of £310,000. And we've separated out the launches to try and make it clearer to potential applicants of the differences between streams. But once all the grantees have been selected, they'll all be part of the same program. And we've been asked, could you please describe the expected role of secondary partners, including budgets? Yeah, I mean, so it depends on the level of expertise that the lead partners have and who else you feel needs to be involved. So, for example, sometimes we have NHS hospitals who apply, but apply alongside a academic partner at a university if they want a particular focus on a research angle or training on students. And similarly, in the overseas institution, it may be that there's a separate health institution that's included because the partnership deals with the amount of money available. They can work with 2 institutions. It may be that a regional governmental office is on the proposal, or a professional association linked to the cadres involved. When it comes to budgets, so we would just yeah, you don't necessarily have to lay out exactly who the money will go to. In terms of how the funding works, SET will sign a contract with the lead UK or Irish partner, and then it's up to that partner to then distribute the funds according to their project activities. It may be that they pass it on to their partners in sub-Saharan Africa. And in the budget, we're not asking you to say which institution will kind of keep hold of the money and use the money. We're asking you what activities the money will be spent on. In the project management section and the M&E section, we encourage you to put some funds in there for staff time. So inevitably there will be, you'll probably say, okay, UK partner, project management, 5 days a month at this rate, etc. And then overseas partner, however much time. So yeah, through that mechanism we'll have an idea of where the money will be spent, but we don't need it explicitly spelled out.
Okay, so Furi's asked a follow-up question about the startup grants. Are you going to organise another briefing or webinar? So we weren't planning on doing another webinar specifically for the startup grants, but when the call is announced tomorrow, there will be different call for application documents and Q&A documents, which will go into further detail about what the startup grants involve and the process for applying for them.
Yeah, and it's essentially, if you're interested, it's just it's just a smaller load of activity that we're asking to see, and it will be a bigger focus on just getting a needs assessment done in establishing a formal relationship with the partner and perhaps doing a bit of training. But I think that the maximum funds available for that is £10,000.
Yes.
So, there's only a minimal amount that partners that we'd expect partners to be able to take.
Yes, Daniel, do you have another question for us?
So Daniel's asked whether that will assist local organisations getting in touch with UK or Irish partners. We certainly can do. If you email agp@thet.org letting us know the kind of work that you're interested in doing, then we can have a think about whether partners who we know or have worked with in the past would be interested in getting in touch. We then have to reach out to them first to see if they're interested in contacting yourself, and then we can go from there. We can also send you a link to, there's various sections on our website which has either lists of partnerships or historic activities that partners have done, which you may be interested in reading about before deciding or thinking about which partner you'd like to come on board with. So again, just leave it a little while longer just in case there are any more questions.
Okay, so it looks like we don't have any more questions, but if anybody does think of anything after this webinar's closed, do feel free to email us at agp@thet.org and we'll get back to you as soon as possible. Great, well thank you for joining us today. We look forward to receiving any applications from you, and if you do have any questions, do feel free to get in touch with us. Okay, thank you very much.
Thanks very much, everyone.